Viewers, welcome back this morning to the Tobago Updates Morning Show. Just before we get into our first interview this morning, we want to continue on with our birthday celebrations for today, the 16th March 2023. And one of our favorite persons here celebrating her birthday, Shirley Cook. Happy birthday going out to you this morning. We trust that you have a really great one. And that's a fun pic of you there up close and personal. Shirley, we trust that you have a great one. And lots of love from all of us here at Tobago Updates. One of our favorite persons indeed. And this is one of our lovely friends here, Mariska Thomas. She was one of our guest hosts for the show last week as we focused on women. It was our Women's Week as we concentrated on International Women's Day that was held on the 8th of March. Mariska Thomas, happy birthday going out to you, and lots of love from the entire Tobago Updates family. Well, viewers, interesting topic this morning for discussion. Our guest on set, Dr. Alina Williams, is going to be chatting with us this morning, and she is a clinical psychologist. Our topic of discussion, in fact, on the rundown, let me explain this. It's postpartum depression and what to look for. Now, I'm understanding that we no longer go by that term. We no longer use that term, postpartum depression, and it is now perinatal mood and anxiety disorder. So I'm hoping that we can put that new term up on for the CG bar. No longer postpartum depression. It is now perinatal mood and anxiety disorder. Good morning and welcome to you, Dr. Williams.
Thank you, Ria. Thank you so much for having me. I'm excited to discuss this. Good morning, Tobago, and thank you for tuning in.
I am as well. Now let's get right into things.
Yes.
What is it?
So most people are accustomed to the term postpartum depression, and that sort of restricted our understanding of the maternal mental health difficulties that women experience. Now, if I were to ask you, what is the #1 complication of pregnancy? Most people would say something related to physical pain or physical complications, but it's actually perinatal depression. So what does that mean? The perinatal period covers from conception through pregnancy up until 1 year postpartum. And we've recognized that most women experience not just depression, but anxiety, as well as a range of other distressing symptoms during that perinatal period. From conception, there is HCG hormones, rise in progesterone and estrogen. There's nausea. There's sometimes for women, they experience extremely bad nausea, which is distressing, sleep deprivation. A lot of changes happen early. So we recognize that it's no longer just postpartum that women are experiencing distress. It is from the moment of conception.
Does it differ in terms of age? Is it different for the younger mothers or for the more matured mothers? Or is there an age factor here with regards this disorder?
So there isn't necessarily a issue related to age per se, unless we're talking about teenage pregnancy. So teenagers are at higher risk for experiencing a perinatal mood and anxiety disorder, but the risk factors vary significantly. So there are biological risk factors like genetics, hereditary, if you have a family history of mental illness, if you yourself have had a previous history of mental illness. There are psychological factors like how people respond to distressing situations, personality styles, coping resources, even personal beliefs. And of course, there's social and environmental factors. So things like your support system, if there are interpersonal relationship problems, if you don't have a community around you that is supportive, even culture plays a significant role, poverty. So these things are risk factors and they happen regardless of age. But of course, teenagers are a unique set of group of people that may have other risks that predispose them to higher rates.
I want us to talk a little bit about the signs and symptoms of perinatal mood and anxiety disorder. Now, I know there are a lot of persons who believe that this is this is all part and parcel of it.
Yes.
But are there cases when it does not happen?
So With perinatal, so most people are accustomed to the baby blues, and
Right.
that's the term we hear often. About 80% of women will experience the baby blues, right? This
Right.
starts about 3 days postpartum, and it would last or resolve within 1 to 2 weeks. There's tearfulness, irritability, confusion, and even low mood, but functioning is not affected.
Okay.
When it comes to the more severe cases, so when we're talking about the perinatal mood now, like depression disorders, bipolar disorders, the panic disorders, we are looking at extreme symptoms. So, for example, changes in appetite, changes in sleep. There is extreme confusion, difficulty concentrating, extreme fatigue. Now, we know fatigue is part of being a new mom
Right.
because you have to wake up often to breastfeed, but this fatigue is unrelenting. Even when the mom has time for herself, there is anhedonia, which is an inability to experience pleasure in things that they once enjoyed. You find that there's a lot of tearfulness, crying for no reason. There's a lot of guilt and shame. There are thoughts of death or recurrent thoughts of suicide, even thoughts of harming the baby sometimes. And one thing that is extremely common is intrusive thoughts. Intrusive thoughts are thoughts that just pop into your head. Most often, they relate to thoughts about the baby being harmed, like what if I drop the baby? What if I just drive off a cliff? Things like that that might seem distressing, those are very common. But once you notice significant changes in your behavior, in your mood, the way you think, then of course it's time to think that you may have something more serious than the postpartum blues.
And this is way beyond what we thought, or what we would think is normal or a part
Yes,
of, according to the baby blues.
definitely. Definitely, it's in the extreme. So we look at frequency, intensity, severity. As I say, the postpartum blues would start about 3 days, but it would, sort of give about up to 2 weeks, 3 weeks
Mhm.
postpartum. But PMADs, they last very long. They could go beyond the 1 year postpartum period. And the frequency of symptoms, the person experiences the symptoms almost every day. It's not like a crying once in a while kind of thing. This is
Right.
almost every day. They're unable to function. They're unable to do things like even form an attachment with the baby. So in postpartum blues, the mother still feels a bond and an attachment with the baby. In PMADs, we find that this is disrupted. So the mother has less touch contact with the baby. Sometimes the mother doesn't even want to look at the baby. There is resentment towards the baby. So it's definitely more intense and more severe.
What are some of the coping mechanisms that can be put in place? And we want to talk as well about the family, the role of the family, the role of the extended family as well
Yes,
in assisting this new mother
yes.
with dealing with this. What are some of the coping mechanisms that can
So
be put in place?
what I would say is we have to evaluate for each individual what might be contributing to their experience of PMADs. If, for example, it's sleep, because sleep is a significant risk factor for worsening mental health, then we need to put things in place where a mother could get rest, whether that's combination feeding, where she might pump and allow the father to give the bottle during the midnight period, or if it's that during the day somebody comes over, helps the baby so that she could get some rest, then those things help. But also, when it comes to support, the postpartum period is very difficult. It represents the biggest drop in hormones for women or any person in their lifetime. And in addition to that, if you've had other complications like a C-section, a traumatic birth and delivery, if you had a baby that was in the NICU, or a premature baby, then those things require more support. I would also say, however, that in the Caribbean, we've recognized that a risk factor for PMADs is also intrusive support. So this is where the support is too much. And let me explain.
Please do.
This is the support where you don't even have the ability to make decisions about how you're going to care for the child on your own. So this is the grandmom or the auntie or the nene,
Which could pose another set of
yes,
problems.
telling you to do this, don't do that, do this. And in my days, I did this. And that could actually contribute to experiencing depression and anxiety during that perinatal period.
Now, we also have where young mothers in the Caribbean, persons are always coming to visit. So at 10 o'clock in the morning, they're coming to
Yes.
visit you and the baby, 2 o'clock in the afternoon,
Yes.
5 o'clock in the afternoon, when you want to be able to take a rest. And I often
Yes.
say, if you're coming over to say hi, be prepared to do some dishes, do some
Thank you.
laundry, pass a
Agreed.
broom,
Yes.
sweep, mop,
Yes.
do something. But it's not
Exactly.
just to chill out with a new mom.
Yes.
A new
Yes.
mom usually does not have that time. In fact,
Yes.
if they had that time, they would not be talking with you.
Right.
They would be
They
sleeping.
would be resting,
Yeah.
exactly. Yeah. And I think support systems need to be more proactive. So don't wait to be asked for certain things, you know. Take initiative and say, you know, this person is newly postpartum, I will cover food this week, or I will do
Go ahead.
dishes
Yes,
this week.
yes.
Just if you have a friend that has just delivered, has just given birth, then take initiative to be of assistance. You know, at this point, you don't want to be draining the person, you want to be adding to this person. And many mothers don't ask for help. And that has a lot to do with social media too, because there's this portrayal that mothers could do it all.
Super mom.
Yeah, exactly.
I have to say, I see your social media, your social media, not your rants, you don't rant,
No.
but your stories and your conversations. And you've been very real about being a new mom.
Definitely.
And I'll be honest with you, I was very surprised, but I enjoyed every moment of it because you were very real. And that's a conversation that a lot of young mothers do not have.
Yes.
Because we come from parents, from mothers who knew it all, because by the
Yes.
time we became adults, mommy had it down pat.
Yes,
You understand?
yes.
So this
And
was our role
there's
model.
so many transitions that take place, even in terms of your career. You know, there's a lot of sacrifice that you have to make. There were a lot of opportunities I had to give up because I was now at home with my son, or I had to pick him up from daycare, or I just couldn't be there when I had to see about him. And I have a lot of support around me, Ria, and I still found it very difficult. There were times that I would cry. There were times my son was crying and I was crying too. Like we both crying. I don't know what's happening. And I'm thinking, you know, there are people that do this alone. And I have so much help. I have resources available, but it was difficult. So I know that many women suffer. Many women suffer in silence too, because they feel if they talk about it, that, you know, as a professional, I would step in and have their children taken away, or that we'll call children's authority and have them investigated. But no, these experiences are very normal. And it's only about 1 in every 1,000 person go on to develop postpartum psychosis, which is actually considered a psychiatric emergency. So this is where now you have beliefs that sort of seem real. You might believe that your child is possessed. You might believe that bathing the child with boiling water is needed to rid the child of germs, and you don't find it distressing. You might have strange or odd hallucinations, even thoughts about harming the child, harming yourself. And so as a psychiatric emergency, postpartum psychosis requires immediate intervention, and the onset of it usually happens within 4 weeks postpartum, and it is very sudden. So that's what makes it a psychiatric emergency as well, because it just comes on. What we know is that the biggest risk factor for postpartum psychosis is a previous history of a psychotic episode or bipolar disorder. So it's very rare. I mean, the media depicts that it's more common because, you know, they exaggerate it, but it's actually only about 1 in every 1,000 women would experience that. But postpartum or perinatal depression is 1 in every 5 women, and it is the most common complication of pregnancy. And maternal suicide is the leading cause of maternal deaths postpartum. So not preeclampsia, not hemorrhaging, not even gestational diabetes or anything like that. It's, you know, maternal suicide.
Wow. How can one safeguard against this?
So definitely for patients at risk, for example, what we try to do is have a postpartum plan in place. And it has to be very explicit. We can't leave anything up to chance. You have to know every week or even day by day, hour by hour, what you're going to be doing, how you're going to be operating, who is going to be around you, the resources that you're going to rely on.
Quick question: when do you have this discussion? How do you know then that this patient is at risk? At what point along the pregnancy
Right.
or before conception
Yes.
do you have this discussion?
So if there's an experience where there's somebody that has seen us that has a prior history of mental health
Right.
and then becomes pregnant,
Right.
we automatically start putting things in place in the event they develop postpartum mood or anxiety disorders, right? But during the antenatal clinic too, sometimes there are doctors and nurses that would ask questions, and it's important to ask questions because, as I said, it's the number one complication of pregnancy. A lot of us tend to think it's things like gestational diabetes or hypertension, but no, it's all the mental health conditions. So asking questions, having the OBGYN ask, how are you feeling? How have you found yourself? How is your sleep? How is your appetite? Are you able to get to work? Are you able to do things like you normally did? And sometimes I would admit, we have been getting an increase in referrals related to perinatal mood and anxiety disorders. And I think that means that gynecologists, OBGYNs are looking for symptoms and doing the necessary things that would allow the person to thrive.
So is it that they're now asking questions, or is it that questions were being asked before, but there was a lower
Rate of
number, a lower
response.
rate of persons?
People are being more open, and I think mothers like myself who come out and talk about
Yes.
things openly, because a lot of people be like, before I had my son, a lot of people be like, oh, you don't know what you're missing out, and having a child is the most wonderful thing, and all I got was the good, 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 good.
And then
I did not get a lot of information, especially about the postpartum period. So I remember 4 days after I got home, I woke up one morning and I was like the whole side of my bed was wet, and I'm like, what is this? Something is wrong. I didn't know that postpartum sweating was a common thing, your body getting rid of the water. Like, no one explained those things to me. Then I would have constant thoughts of dropping my son in the sink when I was bathing him. These thoughts will just pop into my head, and all I could see is my son falling in the sink, busting his head, and having blood all over him. And I didn't know that intrusive thoughts happen in up to 90% of women.
and I have to make it clear here. You are a clinical psychologist. You were not having, as far as you know, any mental health
No,
issues.
none.
And so
And I have good support.
what did this do to you when you realized that this was
Yes.
happening?
So when I must admit to that I had a very high risk pregnancy and a very difficult C-section, and those experiences caused me to have postpartum trauma, which is part of the PMADs, right?
Right.
So I would wake up screaming sometimes. I had a lot of dreams and nightmares about blood just because of how my C-section was. I had to have a blood transfusion. And in my experience of having postpartum trauma, I technically healed myself. I went through the trauma protocol that I would use with a patient and applied it to myself to get rid of these symptoms. And I told myself, if I didn't know that what I was experiencing was postpartum trauma, I could go on, which happens in up to 30% of women when their postpartum depression or anxiety is not resolved. They go on to then develop a full-blown depression and anxiety episode. And I feel like if I didn't have, I had resources, I had support, I had everything, yet I had this experience, what does it leave for people that don't know or don't have the kind of resources or access to support that I did? And so that is why I decided I need to be honest and open about my experiences to let people know it's common, it's okay, and it is treatable. It is very treatable. Once you seek help early, postpartum or maternal mental health issues can resolve very easily.
Let me ask you on a personal note. What do you know now about motherhood that you did not know before, or that you may have taken for granted before? Or maybe you felt as though they lied to you about before?
I did not realize how much of a sacrifice it was. Motherhood is pure sacrifice. Um, your body just changes the way your body used to function. That changes, your priorities completely shift. And even in the absence of my son, all I can think about is him. People will be like, leave him in daycare and you go and do things. But I still feel like I am the best person for, even when he's with his dad, I still feel like I am the
You're the
best
best
person.
person
Yes.
for him.
So motherhood is a sacrifice. Parenthood is a sacrifice. And you are never the same person. It doesn't matter whether you are 1 year, 2 year, 15 years postpartum. You are forever changed once you conceive and give birth to a child.
I feel as though this is a Mother's Day interview that we're doing. How can persons get that support? Who should they call? Where should they go? What should they do to be able to move forward?
So once you recognize that your symptoms, I would say, for example, once it's 4 weeks postpartum and you're still having excessive feelings of crying, tearfulness, sadness, changes in just the way you function, even bonding with your baby, you're irritable constantly, agitated, fatigue, etc. I would say speak to your primary care doctor, your gynecologist, or even when you go to your 6-week follow-up postpartum, let the provider know what you're experiencing. Be open about it. Don't be worried that it's going to result in you being admitted to the psychiatric ward or anything like that, because those things, as I say, are
Genuine
very
fear.
rare. Yes, they're very rare, unless it's a postpartum psychotic episode. So be open about it with your primary caregiver, and they can make the necessary referral. But also sometimes mothers too need to just ask for more support. So if you notice you're feeling overwhelmed, get the people around you to be very involved in helping you, even if it's not direct care with the baby, because again, mothers, you think you're the best for the baby, but they could take care of you.
That's right.
Yeah.
I got it. Is there a number they can call? How can they reach out to you?
Sure.
Or do you operate only by referrals?
So we operate mostly by referrals, but we do take walk-ins as well. So people could come to the department, the mental health unit at the Scarborough General Hospital or at the Scarborough Health Center in Bacolet. They can walk in and simply talk to someone explaining what they experience. And we've had that a lot happening recently too.
Let me just share very quickly here with a viewer on the live. The viewer says, I remember hearing a governor's wife said that her husband came home and met her trying to fit the newborn into the microwave. I'm so happy that this topic is being discussed. Thank you.
Yes. I had the experience of a mom that she was cleaning her child with Lysol and bleach and stuff, and it's because she had the belief that the child was somehow infected. So she was having an ego-syntonic, intrusive experience, right? She was definitely psychotic. And that's when it represents an emergency. But for most women that have distressing thoughts, it's ego-dystonic. They know that it's distressing. They feel uncomfortable. And at that point, you should reach out before it progresses to anything serious.
Thank you so much for chatting with us this morning, Dr. Williams. A
Thank you for
pleasure
having
indeed.
me.
Remind us again of a contact or location that persons can call or visit.
Right, so the mental health unit at the Scarborough General Hospital, the unit is also at the Bacolet Health Center. The number they can call, 660-4744, extension 3157. That's the mental health unit. You could come with a referral or you can walk in.
Okay, thank you so much. Thank you so much there. Viewers, lots more coming up on the Tobago Updates morning show. So remember, share the live, share the live, share the live.